If you had a shift in your foundation of your house, would you be trying to repaint the cracked paint or replace the windows that are getting warped? Or would you be looking for the core foundational element problem? I believe the low back is one of the most overlooked and mishandled as far as musculoskeletal injuries. There is so much intimate anatomy that's happening at the pelvis, the sacral area, fifth lumbar. As distortions happen there, they go up and they start to change muscle angles, ligament angles, they change shoulder height, they change the way your eyes and your jaw associate with the horizon. It changes the way the blood supply and the cerebral spinal fluid is circulated through your brain and through your discs. It changes the reflex arcs with your hip, knee, ankle anatomy. And that's just the bony stuff. What about the soft stuff? Clinically, what we see with low back injuries is specific injuries related to hemorrhoids. Hey, thumbs up. Specific injuries are related to kidney issues, pelvic floor distortion, with baby position in utero, disrupting motility in the lower point of the intestines, testicle pain, vaginal pain, chronic hip flexor tightness, chronically tight hamstrings, sciatica. All are related from the anatomy being distorted in the low back. And those are just the common ones. Sometimes we get people that get migraines from their low back. Some people have vertigo that comes from their sacral area. We get the occasional kid that comes into the office that has chronic bedwetting more than 3 times a week and they're over 8 years old. Chronic constipation in young kids, asthma in young kids, all being related to pelvic distortion, sacral distortion, and fifth lumbar. Why is this not understood more by more practitioners? There is a select few that know what to do, how to do it, when to do it, and actually achieve full correction, not just living with the duller amount of the pain or the lesser of the injury. So today I'm just going to talk about the anatomy of the disc very quickly, very top level, and that maybe, just maybe, it's a disc injury, and finding someone that knows how to correct that, at least in a holistic way, might be the route to go. So if you're not familiar with what the disc is, imagine 2 vertebrae stacked on top of each other. You have 7 in your neck, 12 in your mid-back, 5 in your low back, and into the tailbone and into the coccyx, they are separated by pseudodiscs per se, but they're more like ligaments, at least when you develop past 25. So imagine you have a disc. 1 bone on top, 1 bone on bottom, disc in between. Distortion in that disc is what we believe the main cause of most musculoskeletal injuries and even organ dysfunction. And there are exceptions to that rule. So you have this jelly donut, and in the middle, a high water content nucleus. So the part in the center has high water, protein, sugar, and when I have downward compression on it, whether it's rotation, whether it's actual compression, or whether it's habitual with posture and ergonomics over time, that disc starts to break down. Specifically, there's little rings, little concentric circles that protect that nucleus, hold it in the center. Those start to distort over time. So that nucleus starts to gravitate outward. Starts to distort this way. And what you guys have heard as a disc bulge, a disc herniation, disc swelling, disc sequestration are all a sum of that nucleus in the center migrating outward, breaching those annuluses, and starting to cause nerve pressure. And I'm not saying direct nerve pressure as in soft tissue connecting to soft tissue. I mean that disc starts to distort, breach apart anatomy, and then now you have swelling. You have positive pressure, more water, because you're not able to push nutrition in and pull inflammation out. Can anyone tell me how exactly spinal discs get nutrition? It's not through direct blood supply, like your brain or your organs. It actually gets nutrition from motion. When I walk around, I create a pump. It pushes nutrition in, it pulls inflammation out, like this. When I have distortion at the bone, I have that bone starting to change its relationship with the one above, one below, because the disc is failing. It cannot pump effectively, so it cannot imbibe. It will not push nutrition in, it cannot pull inflammation out, so that inflammation starts to increase and that pressure starts to increase. And that biochemical soup over time starts to agitate the neurology. It stretches soft tissue. It changes reflex arcs because now you have pressure on them. Your body will not want to move into the path that causes pain. Your body will actually actively avoid that and prevent that. Have you ever seen a friend with their neck stuck like this, or maybe you? That's called antalgia. It can happen to anybody. Your body is keeping you away from putting pressure on the nerve because the nerve has biochemical irritation. And the nerve has biochemical irritation because the disc itself has started to fail. What are we doing when you're trying to correct it? When I, specifically, am finding the exact bone that's the problem, the right way to correct it, the right depth, and how it is associated with everything else. It's not just a mechanical shift. When I'm setting a bone, I'm creating negative pressure. I'm getting that bone up on top of that disc, and it's creating pressure, starting to pull that breached disc material back to the center. That over time especially with training, icing, low inflammatory diet, learning cross-crawl body patterns. There's a lot of active therapies to implement with that passive modality, i.e. me doing something to someone, to start to resorb that disc. Once that disc material is fully resorbed into the center, those little rings that are all around need to rebuild. Scar tissue needs to be laid down to fortify that nucleus back to the center. So now you can see the same way that disc fails over time, breaching those annular fibers and distorting the actual disc and causing pain. That exact process must happen in reverse. I must pull that disc back to the center, i.e. physical corrections. Scar tissue must be laid down in those concentric circles, and that's going to fortify that disc into centration, it being perfectly in the center and associating with the bone above and below. These types of injuries are not just an exercise it out or do your therapies 3 times a day or put heat or put ice or put e-stim on it or sauna or cold plunge. That's not what this is. It's not to say that isn't beneficial. We must correct the relationship. Everything is better off the back end of correct relationships, whether it's biochemically, your relationship with food, physically, your relationship with joint structures and motion, even relationally. Things are better and have less friction on the other side of optimal relationship. And that's one of the core premises in the Gonset work. We're looking for optimal relationship. If you have back pain, find someone that knows how to correct the disc. Find someone that knows how to correct the bone itself on top of that disc and allow that disc to start to resorb while you fortify it with healthy practices. This is not something you can just yank on someone's neck or yank on someone's legs or put someone on traction in hope that it gets better. It must be done methodically, it must be done strategically, and it must be done in the correct sequence so you can get back to the version of you that is able to enjoy life uninhibited. Cheers.